Hi, everybody. I'm Anna, and this is Robert, the founder of Shameless Care. And we're here to have a conversation today about STI testing with the Shameless Care company. So, Robert, could you start me off by telling me why you started Shameless Care?
Well, I'm looking forward to this conversation with you as a practitioner and me as just a guy, right?
Yeah.
But I started the company because I had a partner text me one time and tell me that I had given her gonorrhea, and I was really surprised by that because I had just been tested, STI tested by a company that promised thorough STI testing. But lo and behold, they didn't include throat swab tests, of which I wasn't even aware of at the time. And so that put quite a bug in me to fix the problem, and that's why Shameless Care exists, is to fix this problem. Because at the end of the day, I believe that when people are seeking STI testing, that they really want to know what their STI status is.
That makes sense. So, I'm just going to bring up here a testing company on my phone because there's lots of them, as
There
you
are.
know. And so here's just one of them. And I want to know, what are your thoughts on this particular STI testing company and what they have to offer?
Okay, so I'm familiar with this one. The first thing is that there's clearly no physician involved in the process. And I know that because it says on here that when you get your testing kit, you'll register it on their website, which is exactly the same way I just tested the soil in my garden at home. Same thing. I ordered a testing kit. They sent me the materials. I then registered my testing kit with their lab essentially, so they know where to send the results. And I'm not saying that that's good, bad, or indifferent, but it could not be more different than how we do things at Shameless Care. So at Shameless Care, we have a team of board certified physicians. And so when someone orders a test from us, a board certified physician that's licensed in their state reviews their medical information and determines if testing is correct for them or not. And the obvious question is, well, if someone wants to be tested, why wouldn't it be appropriate for them? Well, sometimes somebody may have like a symptom. They may be seeking STI testing because they have a symptom, and in which case, any sort of at home testing kit is just not appropriate. And I can't tell you how many times the doctors on our team will tell somebody, we're not going to charge your credit card, don't worry about it, but you need to go to an ER today based upon the symptoms that you're having. And so a doctor really does make a tremendous difference. And then when the test results come in, they are reviewed by that same board certified physician before they're shared with the patient. And if the patient does happen to test positive, then a couple of things happen that I would really love to talk about mandatory reporting in this with you. Um, a couple of things happen. One is that doctor treats the patient, or if it's not appropriate. So, for example, the CDC recommended treatment for gonorrhea is an intramuscular injection, which we're not going to do by telemedicine. So they're referred to an in-person, clinic. But nonetheless, that doctor is responsible for seeing that case through from beginning to end. These are medical tests, and they need to be overseen, in my opinion, by a medical practitioner.
I agree with you 100%. As somebody who sees patients every day, patient care should be the center of every interaction when it comes to treating these things and
Yeah.
diagnosing these things. 100% agree. But my problem is, certain companies are just out to provide people that security of an STI test. So when you look at how Shameless Care works versus other companies, who do you think is going to sell more tests and why?
Well, they're certainly going to sell more tests than ours because they're less expensive. I mean, I've already told you they've removed the doctor from the equation. I mean, maybe they have a doctor whose license number appears on all the lab reports or something like that, but I highly doubt if that same doctor is actually reviewing every single case that comes in. They're certainly not reviewing it before the lab test is ordered. That part is obvious. Some of these tests you can order right from Amazon.com. And so their testing kits are cheaper. I mean, looking at this testing kit, it tests for HIV and syphilis, and it says gonorrhea and chlamydia. Well, it's only genital gonorrhea and chlamydia. So anybody that has oral sex, it's automatically not going to be appropriate, in my opinion, for those people because those people are not actually going to know if they have gonorrhea or chlamydia at the end of this testing program, right? not to mention trichomonas, which is the single most common curable STI in the United States, or Mycoplasma genitalium. I could go on and on. So it seems to me that what they have done is put together a testing kit, put enough tests on the front of the bag, and STIs that people are aware of, HIV, syphilis, gonorrhea, and chlamydia. I mean, the average consumer who doesn't know any better is going to say, oh, that looks pretty good. And the price is definitely good.
Yeah.
Well, yeah, it's only 4 STIs and there's no doctor involved. That's not very expensive at all. I mean, I'm not going to share with the world what our healthcare, what our costs are in terms of paying for our physician's time, but it is a significant percent of someone's experience at Shameless Care. And it's a significant part of the expense that we have as a legitimate telemedicine company. So they're definitely going to sell more tests than ours, because at the end of the day, a lot of people are just looking for a low price. But unfortunately, their consumers are not actually going to know if they have an STI or not. They're going to know if they have a few STIs, and maybe that's good enough for them. But I suspect that most of their customers don't know that.
It sounds to me like what you're saying is you kind of get what you pay for. Is that what you're saying? Or it just seems like that's the general gist of what
You
you're
get
saying.
what you pay for.
Yeah.
And unfortunately, I don't think healthcare is one of those things where you trick the consumer.
Yeah.
Right. So I think that, anytime somebody is selling an STI testing kit that doesn't include throat swabs, knowing full well that not only do most people have oral sex, but most people have unprotected oral sex,
Yeah.
that you should be telling the consumer that you should be telling them that while you have negative gonorrhea and chlamydia results, it doesn't mean that you don't have gonorrhea and chlamydia. At shamelesscare.com, we also don't include HPV testing, but we explain on our website why not. And there's some very, very, very good reasons why not, which I won't get into in this video. But anything that we do not include in an STI test, we explicitly state. And I think that's the way healthcare should be done. I think healthcare needs to be treated differently than like if you're selling sunglasses on the internet or something like that.
So you've mentioned healthcare several times, and I work in a clinic every day, and I want to know how the experience for a patient for you at Shameless Care could be more advantageous to somebody who's coming into a clinic for somebody like me. What is the advantage they have for going to a telemedicine company like Shameless Care versus an everyday clinic like mine?
Well, we're certainly not trying to keep people away from their in-person doctor. I think everybody should be seeing their in-person physician or PA or nurse practitioner or whoever, probably at least once a year. But I think for people who are sex positive and who are seeking STI testing, that they're going to have a better experience than Shameless Care than at their in-person doctor. It can be really quite annoying to make an appointment and travel to the doctor's office, and then you wait in the exam room, and then you get weighed, and then somebody does the O2 sensor on your finger and looks in your ear and up your nose, and the nurse comes in, wants to know what you're there for. Oh, I sleep around, I want to be STI tested, and then she leaves, and the doctor comes in, you got to say the same thing to the doctor. I just think that at the end of the day, there are certain things, and by the way, that doctor is probably not going to know what throat swab testing for gonorrhea and chlamydia is either. Hopefully they will, but probably not, and in which case you've wasted all of that time. So I think there are certain things that people need to see a specialist for, and I think at the end of the day, for thorough STI testing, there are no better specialists than the doctors at shamelesscare.com.
I think you're right. I think it's really hard to know especially when you're seeing dozens, if not more, patients a day, and you're trying to get through your numbers, you're trying to get all your documentation done, that it can be really difficult to remember to be as thorough as we should. That and the training provided is not always, quite frankly, as thorough as it should be when it comes to medical practice. So I agree, when you have people who deal with this day in and day out every day, it just makes for a better experience for the patient, which is so important because they're what matter. Patients are what matter. And I really admire that that's what you've made that part of for Shameless Care as well.
Yeah,
So,
not to interrupt you, but we
yeah.
actually just came up with some resources because a lot of people do work hard for their insurance and they want to be able to use it, and we don't accept insurance at shamelesscare.com for a variety of reasons, which I won't get into on this video. But some people want to get shameless care quality testing at their physician's office, but they'll tell me that their doctor's not aware of throat swab testing or whatever the issue may be. And so last week we interviewed an OBGYN
Uh-huh.
who is very knowledgeable on the subject. And we created 2 videos, both of which you can find on the YouTube channel. So please like and subscribe if you're so inclined, want to help us out, but also watch that video. And the one video you watch before you go to your doctor's visit and kind of empowers people and gives them a bit of a primer on how to talk to their physician. And the other one is a provider to provider video. It's about 60 seconds long, where if that doctor in the exam room goes, I would love to do that throat swab for you, I've just never done it before, so I'm a little unsure how to do that. You can show them this video where the doctor says, it's the orange Aptima swab. You already have it in your exam room. You use it for strep throat. It's also good for gonorrhea and chlamydia. You swab the person just like you do for strep throat, and you code it the same way you do for genital gonorrhea and chlamydia. It could not be simpler. But I think when a provider hears that from another provider, it can really help. So at the end of the day, at Shameless Care, we would not engage in like this kind of stuff where we're selling what is really a subpar STI test to the masses. We want to see people get STI tested properly, whether that's through us or through their doctor. We're clearly the easier way to do it, but we're probably also the more expensive way for people who have insurance, unless you get that bill back and it turns out the lab charged $8,000 for microplasma. But we don't want to get into modern healthcare practices, but
That would be a totally different video.
yeah. But yeah, I mean, we want people to be, at the end of the day, we feel like people who are sex positive, who
Yeah.
are taking that extra step to be proactive, which is what they're doing. They're not waiting till they have symptoms or anything like that. That they deserve that kind of thorough examination, and we want them to get it in whichever way they can.
I think my last question, which is really important, is how can somebody walk away from a STI test through Shameless Care with more confidence than they could from anything else? Because I believe that knowing when you speak to any partner that you can speak to them with confidence about your testing, it's extremely important. So I want to know how that's, you know, how is Shameless Care the apex of that situation?
Well, you certainly have a lab report with all of your results on it, which is nice and easy to understand because I have seen STI tests, especially with the hepatitis world,
Mm-hmm.
in the hepatitis realm, I guess, from hospital systems and things like that that were pretty hard for a layman to understand. It's like, well, we don't know if this person has had a vaccine or if they're positive. Like the doctor knows, the nurse knows, a PA would know,
Yeah.
but the average person doesn't know. So I think just having a very simple lab test result that lets you know immediately if it's all clear or if there's something that needs followed up on is, really helpful. And then, the educational resources that we have, I think are fantastic. I will leave everyone out there with this. When people are talking about their STI testing status, they often say, I've been tested for everything and I'm clean. Well, they might have had a test kit like this, right?
Yeah.
And in which I'm not suggesting that for these assays that's not accurate.
Sure.
But that's only a small part of the picture, and most people don't know that. So I think if nothing else, when people go to shamelesscare.com, they're going to learn a lot. And the more that people know about STIs and that sort of thing, the better that they're going to feel. And the better they feel, the better sex is going to be for them.